This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT-HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. In case you're wondering, Dr. Molly and I are in our beach attire, so we're ready for the heat, okay? And we're also ready to talk to you for the next hour to give you a lot of good information to help you and your family improve your overall quality of life, and that's why we call it Health Watch, because we try to watch your health as best we can here on the show. Dr. Molly, of course, is the PhD doctor and executive director and founder of Innovative Medical Associates, Marlton, New Jersey. And we're going to talk about what they do there and how they do it and why they do it and how it can potentially benefit you and anyone you know. We'll talk about that. And in addition, we'll take your questions at 855-839-1210. 855-839-1210 is our number here in the studio. At any time during the course of the show, feel free to call in and ask a question for Dr. Molly, whether it's about a medical challenge or anything that you want to talk about. That's what we're here for. Good morning, Dr. Molly.
Hi, John. How are you?
Ready for the beach, huh?
Yeah, but I want to say you and I are definitely contributing to the social distancing. Right?
Yes, we are.
We're doing our part.
Yes, we are. We are 6 feet apart.
Amen.
And there's no one in the room here with us.
That's right.
So
That's right.
We're all by ourselves. I want to talk about Innovative Medical.
Sure.
And, you know, I've been noticing, and I guess we're getting the word out through the show in some part, because I've been noticing a lot of new people that I don't know. Pam and I were talking the other day. Like, she said, well, I used to know everybody here. I said, so did I. But now I don't. So I guess there's a lot of new people, and that's a good thing.
I think the most important thing about everybody is that I know them as well as the two
That's
doctors
right.
know them,
That's
and
right.
so do all my help.
Right.
So that's really what's important. But I will say one thing. What's happening is I'm getting a lot more calls in terms of consultations, and sometimes you see them in and out of the clinic. And the thing about it is I'm finding more and more people who are looking, especially since Corona, I would tell you, who are looking to do what? They're looking to improve their quality of life and maintaining their own autoimmune ability to fight off some of these dastardly viruses and things that are out there. So I think that's what you're seeing, as well, of course, people with chronic conditions.
And you've talked often about vitamin C.
Vitamin C is one of my favorites.
And you've also talked about boosting your immune system.
Right.
In terms of fighting maybe a corona or other problems.
Of course.
So I guess a lot of people are coming in because of that.
That's right. And what we're seeing is that people are finally doing the research. Because you know me, I tell people, read about it. And they're finally reading about it. And I say, read all the sides about it. Don't just take my word for it. Read what's out there and read the qualitative data. Again, John, we're back to the same old story. You know, there are conventionalists who will poo-poo everything we do. But I will tell you, come into our clinic, start talking to patients who have been with me a long time, like you and Pam.
Yes.
And find out really what's going on. But I can tell you this, there's lots of data today that supports vitamin C therapy as something to improve your own immune system to help you fight the viruses. Doesn't cure the viruses, but it certainly helps you feel better, look better, and fight these things.
You know, how many times have I said on the show, I said, geez, I hardly ever get a cold.
Well, let's hope that continues.
Right, and one of your patients said, wait a minute, John's not the only one.
I was there.
And he said, I don't get colds either.
Right,
so.
and let's thank God, because, again, a lot of things, but see, John, this is a very delicate balance, right? Vitamin C is vitamin C is vitamin C, but extract of vitamin C, each extract we use is specific to what a patient is coming to see us for. For example, when you have cancer, we don't necessarily give you an extract from oranges. We might want to give you something from cassia. We might want to give you something from tapioca, and the reason being is it has less sugar.
And obviously...
And sugar, we believe, feeds. This is a belief.
Right.
We believe feeds the cancer cells.
All right, let's talk about kind of the overview of what you do. The cornerstone is hydration.
Hydration is our cornerstone, but we are a collective group of healthcare providers and scientists who've gotten together and who, through our own journey, have working out of my facility, okay? And what we want to do by working out of my facility is use hydration as a cornerstone, and then the other modalities come in as ancillary modalities to help a patient through whatever crisis they have. But hydration is the cornerstone. And why do we want to use hydration as the cornerstone? Because through hydration, we are able to deliver some natural substances, things you might find in the vitamin shop, in any vitamin shop, any health food store. You can go in, purchase things like vitamins, minerals, and amino acids, and actually they can then help reduce your need for pharmaceuticals. It may not take you off of all your pharmaceuticals, but it may allow our physicians to prescribe a lower dose pharmaceutical to effectuate the change you want to see.
The hydration then, not necessarily a replacement for prescription,
no.
but an addition to.
It can be an addition.
In conjunction with or whatever.
In conjunction with traditional treatment. And that, of course, goes doubly for some of the chronic conditions we do. But I will tell you that the hydration and the use of the natural substances can help you reduce your need for pharmaceuticals, thereby cutting the doses of some of them, maybe combining some others that are less toxic, so to speak, on the liver, etc. And you then, remove some of the side effects from them.
Are there side effects from your hydration therapy?
Well, yeah. I mean, you want to look carefully. We want to make sure that a patient can then metabolize vitamin C. And there's very clear enzymatic test that shows that. You also don't want to necessarily give an overload of fluid, particularly if somebody has cardiac issues, those kinds of things. You want to be careful about how quickly you run fluid if somebody has hypertension. I mean, there are so many things. This is what separates us from the spa-like hydration clinics.
And that is because you're a medical facility.
We are a medical facility and a medical hydration facility. So therefore, what's happening is we are very, very involved. In other words, I want a history. You don't just come in and say, hey, listen, how about you set them up, Joe? No, it doesn't work like that.
Give me a little bit of that hydration bag, right?
No, it won't work like that. You still have to fill out paperwork, etc.
But your emphasis is on the medical side.
Absolutely. It's a primary care facility. So, of course, we're going to do that. I have two fine physicians and, healthcare providers, registered nurses. I mean, bottom line is we're looking at doing this in a correct manner.
And when you get the hydration, typically it's 1 week, 2 weeks, 10 weeks?
It depends. Well, it's all going to depend on what you want to accomplish. Listen, we have to take our patient's data under consideration. What does the patient want to do? Obviously, if you're in great health and you come in to me and you just want well care, well, you may be doing real well even through this terrible heat in 4 weeks. But if you come to us with a chronic condition, which lots of our patients do, not all, but lots come in with chronic conditions, obviously the length of treatment time, meaning how many treatments you need, is going to be higher.
And it all depends. I guess everybody's different.
Everybody's different. You see that. You've seen people in twice a week, and then you've seen people in once a month, John.
Right, exactly.
So it depends.
And every hydration bag is different.
A little bit.
That,
maybe some of the basic bag looks the same, but you can be sure in those second and third bags, nothing is the same.
Right. We are coming up on our first break of the morning. Our show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210. WPHT. Dr. Molly Fantasia is with us, as per usual. Dr. Molly is the Ph.D. doctor and executive director and the founder of Innovative Medical Associates, and they are located in Marlton, New Jersey. We have more to talk about in terms of what Dr. Molly does and some of the patients and some of the challenges that she's helped patients with. And if you have a particular medical challenge or you just have a simple question, 855-839-1210 is our number here in the studio, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. As always, during the show, operators standing by at Innovative Medical. And if you want to call and get more information, 856-489-0505. 856-489-0505. That is the number for Innovative Medical Associates. When you call, you want more information, they'll provide it for you, and you want to make an appointment to sit down with Dr. Molly. That's really how you'll get a lot of your questions answered, and that's what you do. Call it right now, 489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And a quick reminder, if you miss some of the show, like, oh, gee, I got up a little late this morning. Well, we have our Health Watch replay every Sunday from 4 to 5, so you can't miss it then, all right? Very simple. And, of course, we're live here now on Health Watch every Sunday, 8 till 9, Talk Radio 1210. WPHT 855-839-1210. You want to talk to Dr. Molly right now here in the studio, 855-839-1210. Interesting this week, Dr. Molly, some patients brought in their moms.
Yes, this was fun
Interesting.
today. You know, John, we're always talking about hydration, but what was interesting this week is I had several patients who brought their moms in. And the reason why they brought their moms in, this is sort of funny. They thought possibly they wanted their temperature checked at the door. They thought that possibly they were suffering from coronavirus. And it was interesting. They really had none of the other symptoms of corona, just some fatigue and some anxiety, actually. And they were irritable, and a couple of them were depressed. So I started thinking about this, and I said, hey, and then we did a quick checklist about dehydration, exactly opposite of what we do. So think about it. We're talking about hydration. I'm talking about dehydration right now. So these fine women were all dehydrated. And some of the early symptoms of dehydration are very important because they can mimic other things. So the fatigue, the anxiety, irritability, depression, cramps, and headaches. Well, guess what? That mimics corona, but not one of these people had a hard time really breathing. They were a little short of breath, which is also related to dehydration. So when they came in, of course, I discussed it with our docs, and bang, we put them in the chair, and I will tell you, in a few hours later, they were all jumping for joy. They got extra fluids, they got electrolytes, they got some vitamins, and they were all happy, and these women were all in their late 70s or early 80s.
So it
was a good story.
Right, they didn't have corona. But that, with all the media hype now.
Exactly. They're
everybody
worried
thinks
to
we
death.
got it.
So
Yeah.
they have wonderful daughters and sons who are just so concerned about their mothers, which I will tell you, I have very thinking patients, right? Very thinking patients. And they started to see their moms looking like this. Now, listen, guys out there, don't forget your dads either. I mean, this doesn't just afflict women. So one of the things I want to say is it's so interesting because this goes back to what I talk about. It's a medical hydration. Hydration is a medical procedure. And let me tell you, when you go somewhere that possibly isn't so in tune to the medical end of this, I would beware.
How do you know you're dehydrated?
Well, you got to look at
what would be like a sign?
You know what? The skin is one sign. The skin is the one sign. But you know, it's interesting. There's a lot of other, when it gets to be more severe, you can have heartburn. You can have joint pain. You can have back pain. You can have things that mimic fibromyalgia, constipation, colitis, because you have the diarrhea possibly. So you've really got to be in tune with this. And in this weather, you really must tell your folk. By the way, I don't want to use the term elderly, John, because that puts us right in there.
Right.
But okay.
well, we are.
What you have to do is be extremely careful, right? When you're out, you must drink a lot of fluids. I would get some water with electrolytes in them. You know, I have a brand that I love. But you really got to start looking at this. Eat a little lighter, but there are many things, but looking at the skin, looking at the power, that kind of thing. But the fatigue tended to be the overriding thing, and also the fact that these people weren't just quite themselves. And you know, you lose some of your cognitive function. That's the thing.
Do you drink a lot of water in weather like this? Is that what you recommend?
I would definitely drink a lot of water. And even then, sometimes it's just not enough. So obviously, the most direct hit you can get is through IV. And I will tell you that they were dancing. By the way, 2 of them decided they're going to become patients. So it was great.
Okay.
It was
That's
great.
good.
It was great.
That's right. 855-839-1210, our number here again. Health Watch every Sunday, 8 till 9. Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. Want to talk to Dr. Molly right now, 855-839-1210. We have often talked on this show, and you have talked about neurodegenerative
diseases,
and I know you wanted to talk extensively today.
A little bit more about it, yes.
I mean, where do you start?
Well, that's the age-old question. As you know, one of my wonderful medical directors has MS. I'm recently doing, and she is a patient of our clinic, as well as one of the associate medical director, and also we have several people who we've treated in the last 6 weeks or so with not just MS, but like subsets of the MS, some types of problems with MS. And we've also seen people with some dementia. And you know I'm doing that PSP patient, which is a neurodegenerative disease. One of the things that I find interesting is that there are many things that affect brain health, and I put neurodegenerative diseases in the brain health category. So obviously you want to make sure that you have somewhat of a diagnosis. Now sometimes it's mystery diagnosis because it's mixed. But it would be good, and one of the things I urge our patients to do is get to a neurologist, because it helps us. If you get to a neurologist and you get a diagnosis of sorts, then the medical team and I can come up with a recipe that really will help the patient with the specific problem. One of the things we hear a lot about is dementia. Well, you know, dementia has certain subsets to that. In other words, there are different types of dementia. For example, there's vascular dementia. Now, that's one we see more commonly. That's where we have hardening of the arteries. The blood flow isn't getting up there. Therefore, the patient doesn't have enough blood to really think their way out of problems, etc. There's also Alzheimer's disease. That's a little more complex because that really has to do with protein buildup and some other things, maybe some things related to mental health as well. Then there's Lewy body disease. And if you know anything about that, that's purely a buildup of certain proteins. And actually the PSP that we're treating is similar to that in that it is a protein mechanism that stops some of the brain communication. Then you have mixed dementia. So, and of course, then we have all of the neurodegenerative diseases that affect nerves and muscles, etc. So that would be like MS and Parkinson's and Huntington's, which is genetic, unfortunately. So here we are, faced with all of these types of diseases. I started thinking, well, what other sources can cause some of these problems? Well, we all know, we use the term toxins. You know, people in the integrative field use the word toxins a lot. What the heck are toxins? Well, toxins can be organic. They're usually organic in nature, which means they can be either man-made toxins like chemicals. We all heard about Roundup.
I was just going to say cleaning products.
Yeah, cleaning products. Roundup. You know, Roundup, they know now, contributes to certain cancers, right?
Yes.
Including the blood dyscrasias. So there's this type of thing. And then we can have some organic things like mold, bacteria, dust that is organic. It could be just waste from dust mites and things like that. So there are many things that can really contribute to brain health or lack of health. So I started looking at that, and we have protocols for all of this. You know, John, you're always saying, well, you have a lot of protocols. Well, yeah, because there are a lot of variations in subsets of conditions.
Yes.
So, of course, you need to have variations in the protocols, not just because of the variations from outside, but the protocols that are variations from the person's own physiological responses. So it depends on what they're responding to. So I've looked at many things, and I'm looking at brain like I looked at gut, our gut, right? I always talk about leaky gut. Well, how about leaky brain? Isn't that cool?
Yeah, that's interesting.
It is interesting because you'll always hear us really say that the gut is the small brain. That's what we like to call it, the little brain. Why? Because a lot of the kinds of challenges and actually some of the physiology of the gut is similar to the brain. So it has some of the cell receptors that they have in both areas. And interestingly, there was a study out of a university in Ireland that showed that anxiety can be related to poor probiotic or the good bacteria in the gut. Isn't
Yeah.
that of course, everything comes out of Europe, right?
Right, exactly.
But it was interesting. It's an interesting study. The other thing is, I found out with mental illness that probably 50% of the dopamine we need, and everybody knows that dopamine is important in brain health, originates in the gut, and a vast majority of serotonin originates in the gut. So what am I saying? I'm saying it's very important that we have a healthy gut, and our protocols address the gut as well as the brain.
Okay. I have more questions, and I'm sure
Sure.
some folks have questions, and we'll get to that after the break. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, executive director, and founder of Innovative Medical Associates, located in Marlton, New Jersey. Our number here in the studio, you have a question for Dr. Molly, 855-839-1210. And we always tell you, try to call early, because usually at the end of the show, people want to get in here and we can't take your call. So this is a good time to call, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates, 856-489-0505, 856-489-0505. That is the number. You can call now. You can call after we leave you at 9 o'clock. You can call during the week. But call 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. A lot of good information on that as well about Innovative Medical Associates. And right now here on Health Watch, Dr. Molly Fantasia is here. And if you want to call in with a question or a thought, 855-839-1210. We've been talking about the environment, Dr. Molly, and it seems like more and more toxins in the air.
Right.
And that's a problem.
It's a big problem because, again, it dysregulates a lot of the hormonal cascade. It dysregulates a lot of the biological cascade in terms of a cellular function. So part of the problem is, for example, I'm very excited about environmental medicine. It's something that I'm into and have been into for a long time. And there is a very interesting group that I'm a member of and just got elected to that really works on these kinds of issues. But when we look at these issues, we're looking at issues in twofold. The kind of problems that come from mold and viruses like corona and bacteria, those kinds of issues, okay? We're also looking at issues like heavy metals, something I talked about before, lead, arsenic, mercury, those kinds of things. Now, there are similarities in treatment in that we have to use certain chelators. You've heard me talk about that. You all heard me talk about EDTA being one of them, and actually was originally started out for lead poisoning. But there are other chelators. Believe it or not, vitamin C has the ability to be a chelator, in particular for things like mold, etc. So, look, folks, some of the things that may be happening to you, some of your conditions that may be happening to you, may be related more to the outside toxins that are causing your body to dysregulate.
All right, let's go to the phones and talk to John in Cheltenham. John, good morning.
Hi, John.
You're on Health Watch with Dr. Molly.
Hi, John.
Hey, Dr. Molly, this is John Carone. How you doing? We've
Good.
spoken
Several times,
giving
yeah.
you a quick,
Cool.
giving you a quick
Cool.
update on Gary, my friend that we spoke about, and it's going to come see you in between
How's
his
he doing?
hospital stays.
How's he doing?
He's doing a lot better.
Thank God.
I've been doing a bunch of coaching vis-a-vis
Good for you.
your constant coaching to us. But I wanted to ask you a specific question. He's been on a regimen of now trying to get his ankle infused, and about the knee situation
Right.
with his two
He really
knees,
has
and
a
we're gonna
mess
come see
there,
you
yeah.
we're going to come and see you for the hydration therapy
Sure.
in between all that healing. He's in a convalescent center that is pretty coachable, but he was told by his orthopedic doctor that he should be seeking hyperbaric chamber treatments before he goes in for another operation on his knees and all that to help fight an internal infection, since he can't get to your office to do the protocols yet because of the hospital stays.
Sure. You know what, John? I have no problem with hyperbaric. But it's interesting that you mention hyperbaric. You know, I do biooxidative therapies, okay, which really are a little different, but nonetheless it promote oxygenation, which then promotes health. But here's the thing about it. I want him to be real careful where he goes. Generally, when your orthopedic tells you this, he wants you to use a hospital system hyperbaric chamber, correct? That's okay.
Yeah.
Just don't go to any of these places that are a little standalone or in spas and that kind of thing, because guess what? You can blow the blood vessels in your eyes. That is a big problem. Okay, so please tell him to get to a system. I know there's a very prestigious system in Philadelphia that has a hyperbaric chamber. So yeah, but his orthopod's going to have to do the ordering for that, and it has to be very specific timing, etc. So please tell him that you spoke to me. I'll happily see him when he's done that, and let's hope that he does well. It's nice to hear from you, sir.
Oh. Nice to hear from you. Thank you so much.
Thank you, John.
You confirm my question. Thank you so much.
Okay. Keep us posted, okay?
Yeah, John's a health coach. John's a health coach who's called our place several times. But, you know, this is an interesting question. Yes. Here's the thing, folks. Anything is good. It's how it's used.
Yes,
you know, anything related to integrative health is good. It's how it's used and who's using it and why they're using it. So again, it goes back to the fact that you want to go somewhere where people really have the knowledge to utilize it correctly. Because I had a patient who went to a hyperbaric quote-unquote physician who was an integrative physician, allegedly, or holistic, and it blew out the blood vessels in his left eye.
Oh, boy. Explain for those of us who do not know. Hyperbaric, it sounds like something from Star Trek.
Nah, it's very simple.
Okay, what is it?
It's high pressure oxygen, and it's O3. And if you really heard about this, it's done under particular pressure, and they used it a lot for scuba divers when they come up with the bends, if you've heard about that.
Yes,
hey, listen, I'm old enough to remember Sea Hunt.
Yes,
are you?
I
remember that with Lloyd Bridges?
That's right.
He had the hyperbaric chamber right there. If they had to come up from under the sea quickly, what happens is the body then doesn't adjust to the change in this. But oxygen can help wound healing, etc. Now, that's interesting that he says this, because there is a lot of data out that there are some other ways to help wound healing as well. Of course, we use some things like platelet-rich plasma, but that's a whole different subject today. But it was an interesting question.
Yeah, when he was saying it, I remember the Eagles had a player years ago
who had to do it.
Who did it?
Okay.
And that's the only time I had ever heard of it. So I just wanted to get a little information on it.
It's quite popular, and it's really quite popular, believe it or not, in seaside hospitals, like out in California, etc. And we do have several hospitals in the Philadelphia area that I know the Philly area because I'm a Philly girl, that have it. But I would want him to go to a system in that case. And I don't necessarily always say that.
Right. Getting back to what we were talking about before the call, and that was the environmental health.
Right.
And
environmental medicine.
You mentioned protocols. You have over 600 protocols. But,
True.
But you have more in terms of the environmental because they're tailored to whatever the environmental issue is, right?
Yeah. In other words, for example, when I talk about desperation medicine, I'm really talking about people who are suffering from these types of syndrome. Many times there's no way to put up an absolute point on what the problem is, because the testing for these types of things, the range is so high, nobody can ever meet them. For example, the EPA sets ranges for, let's say, poisoning, quote unquote, from radon. Everybody's familiar with radon because if you sell your house or you go into an apartment, it better be radon free, right?
Yes.
Well, they also set the parameters as to what that means. So if you have radon gas, but you fall under a certain level, that's okay, they say. But how about if you're a very sensitive person and you start to have all kinds of challenges and you can't put your finger on what it is, and you go to 3 or 4 other physicians who tell you it's in your head? Well, guess what? It may be in your head. It may be some kind of brain syndrome that's happening from the radon gas.
Are we using, and you have many protocols for environmental issues. Are we using too many chemicals?
Goodness.
In our household, like for
Well, you know
cleaning?
how I feel about that. Absolutely, unequivocally. Now, that being said, if we need a certain types of let's say, a chemical that is deadly to the bacteria or the virus, you may need that. But you better make sure that when you use it properly and you have the right personal protective gear to do so, right?
Yes.
When you call these people in. So, yeah, I mean, that is very, very important because guess what? You know, you might need it, but the question is, do you want to breathe it? That's the key.
That's the
you
thing.
want to make sure that the follow-up on it's done correctly, but there's no residual effect on the body. And I will tell you, that's the reason why I got interested in this is because of Corona. How many people have had all these things done in their houses and in their offices, etc., but the follow-up isn't there. So now we found that maybe some of the conditions that they're feeling, like the nausea, the headaches, the shortness of breath, the sweating, this kind of thing, but nobody's worrying about treating it. Well, I believe you have to treat it with environmental medicine protocols, and that may include delivery of IV types of chelators.
All right, we're coming up on our final break of the morning. It's Health Watch every Sunday, 8 till 9, live here on Talk Radio 1210 WPHT. Still have time for one or two more calls if you want to get in here and talk to Dr. Molly at 855-839-1210, 855-839-1210. Again, the show Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we are back on Health Watch. Operators are standing by right now at Innovative Medical Associates, and they will be there well after we leave you at 9 this morning. 856-489-0505 is the number. 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. And also the website, innovativemedicalassociates.com, innovativemedicalassociates.com. When you call, best thing you can do is get the information and then make an appointment to sit down with Dr. Molly. The initial consultation is complimentary. Very simple. You can get all your questions answered pretty much in that complimentary initial consultation. Right now here on Health Watch, our number in the studio, 855-839-1210, 855-839-1210. Couple of minutes left of the show. We have some time for one or two more quick questions if you want to jump in here to talk to Dr. Molly. 855-839-1210. You want to talk about your patient, Sandy, who's always
Sandy's
a good
Sandy's
example.
a good example of things. So anyway, Sandy has a lot of autoimmune type responses. So, of course, she has joint pain. She has tremendous headaches, joint pain, sinus, all of this. Interestingly enough, she went to her primary. And I get a call, and she said, my primary is very upset with my vitamin D level. So I went back to look at the vitamin D level because I expected him to be upset that it's so low. Well, no, it's actually a little high, a little higher than what is our high normal. But it isn't it's not even one standard deviation high, right? So I'm looking at this, but in looking, I had sat with her last week. I'm more concerned with her inflammation markers than that. I'm wondering why he isn't. So, she has a C-reactive protein that is cardiac specific for inflammation. And I, of course, told her to make an appointment with a cardiologist we know because I want to make sure that that isn't just reminiscent of some of the medication that she's taking for arthritis, the rheumatoid arthritis. And I also, I'm very particular about how I work with her. So she's now back in for 2 times a week because I want to get those inflammation markers down, and we are working to do that. So that's one example of some of the things we do. And, of course, my medical directors don't have any problem talking to someone and saying, okay, and I don't either, really. Saying, okay, so give me why you're so concerned with the vitamin D level that's only trifling high.
Yeah.
I mean, think of all the other things in her blood work that are high.
Have you found out what is?
No, I didn't, except that I think he didn't like the idea that she comes for hydration therapy.
Yeah. Oh, well,
Okay.
that was
And
just going to
that's
say.
okay. It's a medical opinion, and that's okay. The other thing is, I got a very interesting case, a woman who had gastric bypass this week, and guess what? Every single analyte that has to do with nutrition is low. You'd expect that, wouldn't you?
Yeah.
So she's in real trouble. And as a result, she was sent to me from another physician who knew she's in real trouble, and we are trying to get her nutritionally balanced. I'm hoping that it takes 10, but it might take 20 treatments to do that.
Okay, and what do you do with that hydration?
Well,
I know it's proprietary.
It's proprietary, but I have to look at what vitamins are very low, of which all of hers were. I mean, her vitamin A, which is aqueous, her vitamin Bs, all her B vitamin, which of course is causing her to have a little brain fog. Her C vitamin is null, completely null. So, and the amino acid she has, I don't even know how she gets up out of bed.
So she's in for 20, it looks like.
It looks like, but we're going to take it one step at a time. But again, she lost a tremendous amount of weight. She looks wonderful, but looking wonderful and then
feeling
internally,
wonderful, right, yeah.
Even if she thinks she feels good, she doesn't know what it's like to feel really good.
Yeah, and you're working on that.
Exactly,
Yeah.
exactly.
Okay.
And of course, my other chronic conditions, cancer, MS, and all the autoimmune disorders.
Yeah, with the cancer, and this has been an ongoing situation in your facility, in that your cancer support has been huge all along.
Yes.
And still is.
Yes.
And unfortunately, many people have cancer.
Yes.
But what does it consist of?
Well,
much?
it can consist of vitamin C, certain other amino acids. It may consist of some homeopathics. It may consist of some cytokines, that kind of thing. Really depends on the patient. I have an interesting patient that has a form of leukemia. He's starting a brand new drug, and I started to do the research on what can interfere with that drug. So obviously, when I do him, I'm going to make sure that any of the constituents we use doesn't interfere with the immune enhancer he's going on for his regular oncologist.
And back to Sandy. I mean, what is the prognosis now?
Well,
I mean,
I think
is
I
it
have
more
to. Well,
hydration?
I think yes. She had to come in an extra day a week, which I believe will help, because I want to really get that inflammation down. And there's only one way to do that. The way to do that is to give her a bunch of the anti-inflammatories that don't interfere with whatever else she's doing.
I wanted to ask you, and I've asked you this before: is it better to come into your facility, let's say when you're in your 40s, and have preventative?
Sure. How about it's better to come in your facilities the minute you get the diagnosis?
Yeah.
How about that?
Yeah.
Regardless of what your age is, whether it's 30, 20, or 70. But the minute you get the diagnosis that's confirmed for a particular type of challenge, particularly autoimmune, particularly cancer, particularly neurodegenerative, it's better to come in earlier than later.
I was thinking of what you were saying earlier about the patients bringing their mothers in.
Yeah, that was a great thing.
And I know that you've had patients bring their children in.
Well,
so
yeah, but we don't treat.
We
really
don't treat children, but I'm talking about young adults. Yeah,
yes,
that's what I'm talking
we would
about.
treat
Right.
young adults. Absolutely, we can't treat children because one of the things is we're just not, comfortable. Children have a very interesting biochemical response, and we have to watch how we move their electrolytes and their calcium. Absolutely, and so that is a particular type of endeavor that is necessary. A particular type of integrative physician.
Yeah, I'm talking about
young adults, of
21 and up.
18, 19.
Okay.
Yeah, we've had plenty of those, especially a lot with GI problems.
Yeah.
A lot with GI problems.
Well, I'm just thinking that to avoid some of these challenges that we're seeing now, maybe, we could prevent them.
You know what, John? You'd be surprised how many of these young kids have GI problems that come in to see me. And it's amazing to me. So is it their exposure to the chemicals we spoke about earlier? Is it their exposure to all the crap in our food? I would say yes. That's also an environmental problem. Everything on the food, everything that's sprayed on the food, and all of that. So there's a lot that we do for the younger kids. Yes.
And guess what? Time's up. How about that, huh?
Okay.
Time flies when you're having fun, right?
It does, John.
Okay.
Thank you.
That's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by, and they'll be there well after we leave you this morning at 9. 856-489-0505. 888-489-0505, and the website innovativemedicalassociates.com, innovativemedicalassociates.com. And if you missed any of the show this morning, it replays in its entirety. Our Health Watch replay this afternoon, 4 to 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Dee, fabulous Franny, and our nurses Jess, Michelle, Crystal, and our medical assistant Kathy, I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. Stay cool. We'll talk to you next Sunday, 8 o'clock, Health Watch, here on Talk Radio 1210 WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.